Recognizing the sign of a heart attack can mean the difference between life and death. In most cases, there are warning signs before a major event, but doctors caution that women may be slower to make the connection because they feel things a little differently. Here's this week's Positively Healthy. You might call it a gender gap. Doctors say women feel differently than men when it comes to their heart.
I feel like as women, we're so busy all the time, taking care of our kids and our husbands. We're not really in tune to our bodies.
Board-certified cardiologist Sarah DeLeon Manson aims to educate women on the warning signs, ones particular to their sex. Women are less likely to recognize heart symptoms and less likely to seek help.
Subtle symptoms in women are lightheadedness, nausea, vomiting, jaw pain, abdominal pain. Those are typically symptoms you don't hear when somebody's describing symptoms of a heart attack.
Men will commonly experience crushing chest pain, bringing to mind images of someone clutching their chest in the throes of a heart attack. These less dramatic symptoms are easy to overlook, which is why doctors say women should be aware of their risk factors. They include family history of cardiovascular disease, smoking, diabetes, being overweight or inactive.
If you have a symptom of nausea and you have risk factors of significant heart disease in your family, then maybe you should get checked out.
What's more, women have additional sex-specific factors that put them at higher risk.
Being postmenopausal, if you had a history of gestational diabetes, polycystic ovarian syndrome, any history of breast cancer is a risk factor.
Failing to heed the warning signs could be costly. Cardiovascular diseases and stroke cause 1 in 3 women's deaths each year. It's estimated 90% of women have one or more risk factors. So when in doubt, check it out. It doesn't pay to be a no-drama mama.